Thanks for staying tuned. The best way to contain the spread of the coronavirus is to stay indoors while the relevant authorities are managing the identified cases. So stay indoors, stay safe. Let's now look at the stories that made the headlines within the week in the nation's capital.
President Muhammadu Buhari has extended the lockdown order in Lagos and Ogun states as well as the Federal Capital Territory for another 14 days. The president gave this directive in a special broadcast to Nigerians, the second since the outbreak of the COVID-19 pandemic. In the meantime, the president met with a delegation from the European Union, where the union donated the sum of 50 million euros to Nigeria for the management of the COVID-19. The Vice President, Professor Yemi Osinbajo, has been holding meetings on the COVID-19 as well. Professor Osinbajo chaired the third meeting of the Economic Sustainability Committee. The meeting discussed measures being put in place to ensure Nigeria's economy enters positive growth by 2021.
We are looking at various ways and means to support each sector of the economy, providing for each sector clear interventions that will be designed with the primary purpose of creating jobs and ensuring that businesses stay afloat during these difficult times. We are working in the next couple of days to finalize our report, to submit the report to His Excellency the President. The assessment of the NBS, the National Bureau of Statistics, is what the IMF is using, has indicated that we'll go into recession to a level of negative 3.4%. But if we take all these measures that we are planning now, we will be able to, by 2021, go back into positive growth. That is why this is very important.
In the interim, the leadership of the National Assembly met with President Buhari. The lawmakers raised concern over the management of donations received in support of the fight against the coronavirus. The Minister of Foreign Affairs, Mr. Jeffrey Onyema, met with China's ambassador to Nigeria over the treatment of Nigerians in the Guangzhou region of the East Asian country. After the closed-door meeting, Mr. Onyema says better communication between the Chinese authorities in Guangzhou and the Nigerian consulate in China would have prevented the diplomatic situation. The federal government is warning that unaccredited private hospitals engaged in the treatment of patients of COVID-19 will now risk closure for an indefinite period. The Minister of Health, Dr. Sagi Ehanire, made this clear while giving an update on the status of the pandemic during the briefing by the Presidential Task Force.
I use this opportunity to again strongly advise my colleagues in the medical profession against secretly or privately managing people who have COVID-19 infection outside of accredited health facilities. Private facilities must obtain accreditation in order to be allowed to treat this highly infectious disease. Practitioners engaging in unauthorized treatment of COVID-19 run the risk of being shut down, their hospitals being shut down for decontamination.
Meanwhile, the Inspector General of Police, Mr. Mohammed Adamu, has read the Riot Act to officers deployed to enforce the lockdown, as well as criminals who may want to take advantage of the lockdown to harass citizens at home. He gave the warning at the daily news conference by the Presidential Task Force on COVID-19. Also at the daily briefing, the Minister of Health, Dr. Sagi Ehanire, confirmed that there are 12 functional COVID-19 testing laboratories with a capacity to test 1,500 samples daily in the country. And finally, the Rural Electrification Agency has handed over a completed solar hybrid mini-grid plant to the University of Abuja Teaching Hospital COVID-19 Isolation Center. The managing director of the agency, Mr. Ahmad Ahmad, adds that similar gesture has been extended to 3 other health facilities involved in the management of the virus across the country.
So I would like to announce that in addition to this, we have also done another 2 isolation centers in Ogun and another one in Lagos, making 4 in total. All in all, we started this work just less than 2 weeks ago, and we're very happy that we're able to complete it within this emergency situation, and given the lack of movement, which we've had full cooperation from the NCDC and the Gwagwalada Teaching Hospital, where they gave us all the required support that we needed to finish this work very, very quickly in this an emergency situation, so that we are able to hand over this plan today.